Well, welcome back to Good Morning Arkansas. According to the National Alliance of Mental Illness, 1 out of 6 young people ages 6 through 17 experience a mental health disorder. So today we have Lauren English with Pinnacle Pointe Hospital here to share how to talk to young people about mental health. Lauren, good morning. You are a licensed professional counselor and the business development representative there at Pinnacle Pointe Hospital. You are doing some really great stuff.
Good morning. We're so happy to be here. Thanks for having us.
Yeah, it's exciting to have you, but that statistic is really concerning.
It is, especially when you think about all the things that kids face on a daily basis. That really opens your eyes just to see that it's important that we talk to kids about mental health.
Yeah, it is important. So we'll talk a little bit about how to talk to your kid about mental health. What's the first step you want to take?
First of all, you want to make sure as a parent or as a teacher or just a supportive
someone that works with children
person in the child's life, yes, you want to establish that safe environment. Kids are going to open up or be more likely to open up if they feel like they're safe with you. And so some ways to do that is just make sure that you're really listening. Kids can always tell when you're really engaged.
Don't glance down at the phone. You got to really be engaged in what they're saying.
And they're going to be more likely to open up and talk to you, asking questions about things going on in their daily life. Sometimes they might act annoyed, like, that's a lot of questions, but just keep asking those questions because it's going to be important for them to have that relationship with you when you do talk about mental health and other important things. So
when you establish the safe environment, the kid knows you really care. Then what do you do?
Educating your child on mental health and what it is. It affects how we think, how we act, how we feel. It affects how we manage stress. It affects our relationships with others. So being able to really break that down and just say mental health affects everything in our lives, just like our physical health. And another good thing to talk to kids about is like how our mental health and physical health relate to each other.
So they're tied together.
Yeah, so a good example is if you're really hungry before lunch, your stomach's growling, how is your mood?
Yeah,
you're probably
some of you get hangry.
Exactly. So those work together. We as adults know that, but being able to relate that to kids can be really helpful too.
So we say kids, it encompasses a wide range of emotions, and age 6 to 17 was what that statistic stated.
Right.
Is there a difference between, talking to your 6 to 10, 11-year-old and then maybe talking to a high schooler?
Absolutely. As a therapist, I've worked with young kids, but also with high school kids. And one thing's for sure, high school kids can sniff out when you're not being real. They can always tell. And so going back to that, being engaged and being able to really be a safe person that listens and is there for them is so important. So putting down the phone and really asking important questions, but most importantly, listening and being a safe person.
Children under 8 might be a little bit more sensitive.
Right.
You have to be aware of that.
Sure. So most importantly, we just want to be able to work with them on how to identify emotions. So a really good way to be able to do that is just use a tool like a picture or maybe an emoji.
Maybe like this.
Yeah, exactly. And being able to use these faces to help them understand what they're feeling on a daily basis. A good example is, so show me the face that you feel when you go to recess.
Yeah.
How are you feeling then? And being able to do that in your daily conversations is going to help them become more aware of their emotions.
All right, and we just kind of hit on it, some tips to talking to adolescents, teens, maybe your high school-aged kids.
Yeah, those are all great tools that you can use as a parent or just as a guardian, anybody important to the child in their life.
Maybe a 17-year-old looks at this and goes, well, I'm not feeling any of that. You have to get on a little bit deeper level with those age kids?
I think with them that the more you listen, the more they're going to be able to
So it really has
open
to
up.
be genuine. All right. Well, what can you do if you notice some warning signs for depression, anxiety with your child? What are you looking for in really the entire age group?
Well, it's just important to be able to key in on what your child's behaviors are like. If you're starting to see them isolate or maybe not hang out with friends as much or lose interest in activities, you want to really pay attention to that. Please don't ignore any of those signs because it can really turn into severe depression or maybe they're facing anxiety about something at school. So all of these conversations and ways to connect that we've talked about are going to be able to help you if that does happen.
Even if you don't notice warning signs, should you be having regular conversations like this?
Yeah, I think being able to open up and talk about mental health in general is going to help later on, if there's going to be a sign and you're going to be able to say, you know, we've talked about this before. How are you feeling now? Are you experiencing anything like this?
So you're at Pinnacle Pointe. You guys are specifically work with kids.
Right. At Pinnacle Pointe, we're located in Little Rock, Financial Center Parkway, and we are an inpatient facility that treats kids ages 5 to 17. And we can see kids that are in crisis for mental health reasons, and we also have outpatient clinics across the state.
Okay, so there's other clinics that are outpatient.
Sure.
If you knew someone or had a child that needed a referral, what's the process like?
Well, call us at 1-800-880-3322, and we have licensed professionals 7 days a week, 24 hours a day that can help you.
Okay. That's very important, and thank you for joining us for Therapeutic Thursday. Some very important tips to talk about with your kids, especially ages 6 to 17, a very crucial time in life. Hey, this is Lauren English from Pinnacle Pointe Hospital in West Little Rock. Thank you for joining us.
Thanks for having me.